Good morning, good afternoon, good evening to all you beautiful people out there. My name is Dr. J, a physical therapist here to get you out of pain and back into the game of life. In today's video, I'm going over some of my favorite exercises that I like to give my patients with back and hip pain. Now let me start by saying there isn't just one best exercise that works for everyone. Everybody is different, and there are a lot of different factors that go into back and hip pain, especially when it is chronic. This includes things like nutrition, exercise habits, and even stress. I can get into more of that in another video if you guys would like. But today, I want to go over a few of my favorite exercises to help start getting you moving and get you out of pain. So let's get into it. So this first stretch is called a single knee to chest stretch. What you want to do is laying down on your back, grab the back of your knee, and slowly bring your knee up towards your chest until you feel a small stretch either in the buttock area or the lower back. And then you want to hold that for about 30 seconds. Once that's done, you can switch to the other side and do the same thing. You would repeat on each leg about 2 more times for a total of 3 times, holding each stretch for 30 seconds. If it's a little difficult for you to reach and grab the back of your knee, you can grab a towel, a dog's leash, a belt, any of that works. You would put it behind the back of your knee, and then you can use that to help assist with bringing your knee up towards your chest. The next exercise is called a lower trunk rotation. Laying in the same position on your back with your knees bent up, you're going to slowly bring your knees towards the ground until you feel a stretch on the opposite side of your lower back and the back of your hip. Once you feel a small stretch, you would hold that for about 5 seconds and then repeat to the other side. When you move to the other side, you should feel the stretch on the opposite side. Go back and forth about 10 times, just going within a range that's comfortable for you. The next exercise is called a piriformis stretch. This stretch is a muscle deep in the buttock area where a lot of people have tightness and a lot of pain can come from. Laying in the same position, on your back, knees bent up, you're going to try crossing one leg over the opposite knee. In this position, you might already feel a stretch. If you do, you can just hold it there. If you don't, you can grab onto your knee with both your hands and gently bring it towards your opposite shoulder. Once you feel a small stretch in the buttock area, you would hold that for about 30 seconds. After that, repeat the same thing on the other side. Again, this is one that you can hold for about 30 seconds, doing it 3 times on both sides. This is another one where you can use your towel, your dog's leash, or your belt if you need to. You can wrap it around your leg like this and use that to help pull your knee towards your opposite shoulder. This last stretch is called a prayer stretch, also known as a child's pose. While you're on your knees, you're going to put your hands out in front of you. And then you're going to slowly bring your butt towards your heels as you bring your head down until you start to feel a gentle stretch anywhere in the back of your shoulders all the way down to your lower back. Once you feel that stretch, you can hold that for about 30 seconds, then relax, and you would do that about 3 times. The last thing I want to go over is a self-massage technique. This is something you can do at home using a tennis ball or a lacrosse ball. A tennis ball will be a little bit less firm compared to a lacrosse ball, so if your back's a little bit more sensitive, you're probably better off using a tennis ball. Now what you're going to do is when you're going to take the ball and you want to put it around the muscles to the side of your spine. They run all the way down, or you can even put it to the back of the hip or the glutes. Don't go directly over your spine where the bones are. That's not going to feel good and it's not going to be helpful. So you're going to take the ball and then you're going to find a wall. You're going to put the ball against those muscles and lean a little bit of your pressure against the ball. You don't want to put all your body weight onto it, just a little bit so it feels a little sore, a little tender. And then you can roll up and down, side to side, or even just hold the ball there for a couple seconds. You can do this for about a minute or 2. And it might feel a little sore, a little tender, but it should be a good type of pain. You don't want any sharp shooting pain or numbness or tingling going down the leg. After about a minute or 2, the pain should be a little bit better, and you might even feel the muscles loosen up. But overall, it should feel pretty good. Let me know how these felt in the comments, and don't forget to leave a like and subscribe for some more videos. Thank you so much for watching, and remember, you deserve peace, not pain.